Thank the member and recognize the member for New Westminster.
Thank you, Honourable Speaker. Late last month, most major media outlets in the province carried a very disturbing health story. A BC study of Caucasian, South Asian, and Chinese youth found that type 2 diabetes had drastically increased among young people in all three of these groups. Unlike type 1 diabetes, which is a genetic disease, type 2 diabetes is generally considered to be a disease associated with aging. But Honourable Speaker, it's a disease, as we know, related to unhealthy eating, physical inactivity, and smoking, a disease that develops over time. But according to Dr. Calvin Kay, one of the authors of the Providence Health Study, youth are being diagnosed with type 2 diabetes as early as 20 years of age, while screening for the disease doesn't start, generally speaking, until the age of 40. This particular study showed that 62% of Caucasian youth with diabetes now have type 2 diabetes. That number rises to 86% for South Asian youth and 87% for youth of Chinese origin. And while type 2 diabetes has drastically increased among young people in general in this country and in this province, according to Dr. Parmjit Singh Sohal, a report co-author, the number of young South Asians affected is twice the rate of that of Caucasian youth. And we know from previous studies in British Columbia and nationally that the incidence rate of diabetes amongst Aboriginal people is 3 to 5 times higher than for the population as a whole, Honourable Speaker, and that First Nations people are diagnosed with diabetes at a younger age. So it's not an overstatement to say that we have a diabetes epidemic in this province and in this country. The results of this recent study came as a shock to many people, but the findings are not ones that the Canadian Diabetes Association found surprising. They've seen these trends developing over many years, and they've been sounding the alarm. The Canadian Diabetes Association estimates that 8.6% of the population of BC are living with diabetes today. That's 442,000 British Columbians, Honourable Speaker. So these warning bells are ones that we ignore at our own peril, because diabetes is a life-threatening illness. It doubles the risk of heart disease, of stroke, of kidney failure, of adult blindness, of amputations. And the mortality rate for people with diabetes is twice that for people without it. It's also a disease that costs BC's healthcare system close to $2 billion a year in hospital admissions, MSP costs, and pharmacare costs combined. So there is absolutely no room for complacency when it comes to tackling this disease. It is true that British Columbia has the lowest diabetes prevalence rate of any province, and we have had for many years. That's because we have the lowest obesity rate, and we do well on other risk factors too, including smoking and physical inactivity, and that has also been the case for decades. However, a recent Conference Board of Canada report gave BC only a C grade on mortality due to diabetes, and it ranked BC 4th among the provinces. So we clearly have some work to do. We do have many excellent initiatives in place at the local level, at the regional health authority level, and provincially. What we don't have, Honourable Speaker, is a coordinated and comprehensive provincial diabetes strategy. The New Brunswick government, to its credit, has recently adopted one. The Canadian Diabetes Association has called for one. A provincial diabetes strategy in BC is long overdue. We need to bring all of the best minds together from the Diabetes Association, from health authorities, medical officers of health, First Nations, doctors, nurses, nurse practitioners, dietitians, pharmacists, all of the best minds to develop an integrated strategy. And we also need a provincial strategy that targets young people in particular, Honourable Speaker. And if that wasn't crystal clear before this latest study, it certainly is now that urgent action is needed to prevent and treat type 2 diabetes amongst our youth. And again, in this case, we need to bring all the best minds together, but for it to be effective, we also need to bring youth together so that it can be a strategy that effectively reaches them. What does a youth diabetes strategy look like? Well, I'll leave that to the best minds of the province. Obviously, education, education, and education at all levels are key. Promoting healthy eating, promoting physical activity, not just in our schools, also in colleges and in universities, in skills training programs, and also in workplaces, Honourable Speaker, because we have an epidemic of obesity amongst our young people, and it's getting worse. Taking stronger action to discourage smoking, including prohibiting the sale of flavored tobacco. 30,000 young people start smoking every year in BC, Honourable Speaker, and half of them start smoking with flavored tobacco. We can do something about that. Also, according to the authors of this Providence Health study, early screening is absolutely essential, as early as 20 years of age, according to Dr. Sohal, especially for the highest risk groups. And that's something that we don't do now. Most British Columbians are routinely screened for diabetes at age 40, and that means we have an awful lot of people, an awful lot of young people especially, walking around not knowing that they may have diabetes. Estimates run as high as 20%. And by the time they're diagnosed, the disease has advanced and they're already potentially developing complications. Access to primary care is also a critical piece of the picture, and when hundreds of thousands of British Columbians don't have access to a family doctor or a nurse practitioner, the fact is young people are even less likely to have a family practitioner. You know, young people tend to think they're invincible. They don't necessarily need one. They rely on walk-in clinics. The honourable member thinks I'm looking at him. The fact is that young people aren't even on the radar when it comes to gathering statistics about looking for a family doctor, which is the term this government prefers to use when measuring how many people don't have the GP for me that they were promised by this government by 2015. And access to primary care, to team-based care that involves doctors, nurse practitioners, dietitians, pharmacists, and others is critical to detection, to prevention, and to treatment. A poverty reduction strategy is also an essential element of a provincial diabetes strategy. Every major study of diabetes tells us that being poor is a determinant of poor health and of diabetes in particular.
Thank the member and recognize the member for Abbotsford South.
Thank you, Honourable Speaker. On behalf of my constituents in Abbotsford South, I am pleased to participate in this morning's private member statement entitled Reducing the Risk of Diabetes. Last June, I attended the TELUS Walk for Cure Diabetes in my riding, and I was totally impressed, not only with the turnout that they had, but the fact that there were people there of all ages. I was also impressed by the concern and commitment demonstrated by participants. Thanks to people like Marley Byers and Dave Ramdahl, plus many other volunteers in my community, people suffering from diabetes can take comfort in the fact that people do care and people do want to make a difference. Earlier this month, the Conference Board of Canada released a report ranking British Columbia third in the world for health performance. We beat out other countries such as Norway, Finland, France, Australia, and Germany. Only Sweden and Switzerland ranked higher. The top ranking reflects the high priority this government places on health and quality of life in this province. In terms of diabetes, the report also notes that British Columbia has the lowest diabetes prevalence amongst provinces. Only 4.3% of the population was known to be living with the disease between 2011 and 2013. The report also indicated that BC has the lowest rate of obesity in Canada and does well on other diabetes factors, including smoking and physical inactivity. Yet the report also notes that our province only earns a C grade on mortality due to diabetes and ranks fourth among other provinces, as a member opposite already indicated. This is quite puzzling, Honourable Speaker, and it warrants further investigation on behalf of the government. For the present, it is clear that we need to do more in terms of prevention. Prevention and treatment involves a healthy diet, physical exercise, not using tobacco, and being normal body weight. For those afflicted by diabetes, we as government will continue to provide services and support. Currently, these include extended coverage of insulin pumps for patients 25 years and under in order to support diabetes patients transitioning into early adulthood, and it includes developing new provincial standards for diabetes care in schools. This will include training and monitoring for school district staff to administer insulin for children who cannot yet do it themselves. We will also provide training for staff to administer glucagon, an emergency measure to raise blood sugar levels. Honourable Speaker, British Columbians are covered more broadly than any other province for diabetes medications and supplies. In fact, in 2013-14, the Ministry of Health spent more than $75 million on diabetes medication and supplies through the PharmaCare program, and that is a 96% increase over the last decade. Notably, PharmaCare covers 13 effective therapies for the treatment and management of diabetes, and that includes 9 oral medications and 5 classes of insulin. PharmaCare also covers insulin vial cartridges for pumps and pens. It also supplies insulin pumps and reservoirs and infusion sets for both children and adults. PharmaCare also covers needles and syringes, as well as blood glucose test strips. In conclusion, Honourable Speaker, I wish to thank the Honourable Member for New Westminster for raising this topic for debate this morning, and thank you for allowing me to respond on behalf of the government.
Member from New Westminster.
Thank you, Honourable Speaker. Let me just conclude by saying that, yes, we do, in fact, as I indicated, have the lowest rate of diabetes in the country. At the same time, and we have the best health outcomes, which we have had, as I've pointed out previously in this House, since the 1990s. That's the good news. The bad news is that we still have an epidemic of diabetes, and that epidemic of diabetes is getting worse amongst our young people. That's what was so particularly shocking about this report that was released recently. And one of the key factors is about poverty, Honourable Speaker. The lowest income men, according to a study by the Public Officer of Health, the lowest income men are at 5 times the risk of developing diabetes as people in higher income groups. For First Nations people, many of whom live in poverty, there's a clear connection between the lack of access to healthy and nutritious food and the incidence of diabetes. And if you're young or unemployed or working in a job without adequate benefits, you likely can't afford to pay for the testing devices or much less many of the expensive drugs that you require. So we clearly do need a provincial and coordinated diabetes strategy, something the Canadian Diabetes Association has called for. We need one that is particularly targeted to youth, I believe, Honourable Speaker, and the reason it needs to be coordinated provincially, we have a lot of best practices out there, Honourable Speaker. I see the Minister of Health agreeing with me on that score. We have some excellent programs provincially, locally, and regionally. What we need to do is to bring all of those best practices together in a coordinated way, in an integrated way, in the same way we do in the areas of cancer, HIV/AIDS, cardiac services, and so on, all of which are coordinated province-wide. And that is, in fact, a major gap in BC healthcare. But for a provincial strategy to be effective in reaching young people, we obviously need a targeted and a creative communication plan to reach out to youth. A plan that includes social marketing and social media, a plan that speaks to different groups of youth using messages that resonate with our diverse communities, a campaign, an outreach plan that really does say to youth and to everybody in our province, we have an epidemic that we can't ignore. We can be proud of our record, Honourable Speaker, but we absolutely cannot be complacent. Not when we have an estimated 8.6% of the population living with diabetes, and when we are seeing a steady and rapid increase of diabetes amongst our young people. We need an action plan, we need a provincial strategy that targets youth, that is about prevention, that is about education, and that is about treatment, Honourable Speaker. That's about ensuring a healthy future for our young people. It's also about ensuring the health of our economy and the health of our healthcare budget.